Hi everyone, so I'm Denisha Gariua, and I was supposed to do an Opzelura video like a few months ago, but I get sick a lot, and right now since I'm feeling good, and the migraine has passed, I decided that it's time to make a video and speak on the cream, the side effects. Um, I do have a video on, isn't it shorts? And it kind of shows the photos of me when I had the patches, and now you clearly see that I have my color back. And sometimes, like, I see the color going away, and the white patches want to return. So what I have to do is put the cream on again, which I put on 2 times a day. So as soon as I wake up and brush my teeth, I put on the cream. You have to wait for it to dry before you put any other product on your face. I'll be honest with you, I do not put on sunscreen, makeup. I don't do none of that. Not at this time. Um, and plus, I stay home most of the time. And here in North Carolina, it seems like, yes, there could be sunny days, and then other times it's just straight cloudy and whatever, but I don't really go outside. Anyways, let's start with the side effects because I had to pull up the website here. Um, I get my cream from the VA clinic, and I tossed the paperwork that comes with it, explaining side effects and stuff like that because I looked into it a long time ago, and I believe I started using the cream last year. When did they prescribe me the cream? It had to be like at least, I'm sorry, it's been a while, so at least like 2 years ago, I think they prescribed me the cream. And within a month, 3 months, I kind of saw my skin color coming back. But at 6 months, I saw more color coming in, and it got me so excited. But you have to put the cream on twice a day, morning and nighttime. And when you put the cream on, it itches. For some people it itches, for me it itches. And the dermatologist had told me that if you feel itchiness, it's because it's working. So those are the only symptoms I ever had with it. um so with so this is what it says on the website. Side effects of Opzelura. Opzelura is the only topical JAK inhibitor that's applied directly to the skin. Opzelura can be applied and target inflammation right where you need it. It's also steroid free, so you can stop using Opzelura without tapering. One thing that I got told by the dermatologist is that you don't need sunlight with this cream. You don't need to do the UV light. I've done that too, trust me. I stopped it, and I think I bought the machine from Amazon, but I returned it. But yeah, this cream doesn't need sunlight or anything. But let's get back to this. The most common side effects of Opzelura in people treated for mild to moderate eczema include common cold, diarrhea, bronchitis, ear infection, increase in a type of white blood cell count, hives, inflamed hair pores, swelling of the tonsils, and runny nose. Opzelura may cause serious side effects. See important safety information below. These are not all of the possible side effects of Opzelura. And then it says, call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Insight Corporation at 1-855-463-3463. Safety considerations, it says over here. Opzelura was studied in children as young as 12 years old. It is not known if Opzelura is safe or effective in children under 12 years old. Opzelura is for use on the skin only. Do not use in your eyes, mouth, or vagina. Opzelura may cause serious side effects, including serious infections, cancer and immune system problems, blood clots, low blood cell counts, and increases in cholesterol. In people who've taken JAK inhibitors by mouth, an increased risk of death has happened. In people with cardiovascular risk factors who are current or past smokers, there is an increased risk of major cardiovascular events in people using JAK inhibitors for inflammatory conditions. Do not ask me what a JAK is because I really don't. The JAK inhibitor, I don't know, but I'll look into that later. Blood clots in the veins of the legs or lungs can happen in some people taking Opzelura, which may be life-threatening. What does it say here? Imagine this: a treatment studied in adolescents. I'm sorry, I speak mostly Spanish. I learned how to speak English and Spanish at the same time. I'm originally from New York, so I do have an accent. So I'm sorry about this. So here it goes. Let's see about this study. 20% of trial participants were 12 to 17 years of age, and no clinically meaningful differences in safety were observed between adults and pediatric patients in clinical trials. So that's all I'm gonna say right now. This is not medical advice. I'm just talking about the cream and my experience with it. It clearly worked for me. There are people that are afraid of using the cream because of the side effects and they don't want to take chances, and I understand that. I went for it. There's nothing serious happening to me. All I get is the itchiness on the face. The cream has worked for me, and I'm so happy it did because my self-esteem dropped when I first saw, well, not the first time I saw the vitiligo, but I would say when it started spreading on both sides, and it was like really big patches. And I know there's people in worse case scenarios than me because they have it all over their body. And from what I've been told, and from the dermatologist, and what I've read on the vitiligo awareness group on Facebook, what did people say? The people have said, and the dermatologists have said that it works best on the face, not much on the hands and stuff like that. But to me, this cream has been a miracle. Like I said in one of my videos, I don't know if I did mention it, but I remember going to Lowe's, and this is when I lived in Tennessee. Like, I went to Lowe's with my husband and my daughter, and then some guy started recording my face, like, oh my God, like, what is that? And it made me feel bad. My self-esteem went down to the floor. Like, I'm already in the heavy side. I was never like this. Right now I'm just, taking care of my health to lose the weight, and I'm just so happy that my skin color came back. So if you're watching this, and you have like low self-esteem, and even if you don't, you're beautiful. And if you have this condition of vitiligo, my goodness, you're still beautiful. Just keep doing what you're doing with yourself. If you don't have access to the Opzelura cream, because I believe that cream is like $2,000 and you need insurance. I don't know. Either, speak to a clinic, a doctor, see if they can give you like a sample of the cream. That's what they did with me at first. They gave me like some little bottle of Opzelura. It's not easy having vitiligo. A lot of people do not understand what it is, and so you kind of have to let them know, basically what it is, because people don't know, so they're gonna ask you questions and all this, that, and the third. And I'm sorry that it sounds like I don't know what I'm saying. It's just it took me a while to get on camera to talk about this. It hasn't been easy. I've had people message me on Instagram, like they found me and stuff like that, and my accounts are private. So I decided, okay, it's time to make a video, because one, I'm sure there's other people that have vitiligo and maybe they don't have access to the cream. I really don't know what countries this cream is being prescribed at. I really don't. But I do know that here in the United States, the cream is being prescribed. And if you have insurance, Maybe you have to pay something, and or it could be free, because I get mine for free. But it's such a miracle cream to me. Hopefully they have something else where it makes people more comfortable in using, so that their skin tone comes back. Something else that I've noticed, some other people are lightening their skin instead, because they don't have access to the cream to bring back their skin tone. So they're doing like skin whitening. And trust me, I thought about it, but I decided not to. And I don't judge nobody. People are going to do what they got to do with their body, because they're not happy. They're trying to figure it out, make themselves figure out how to be happy again with themselves. So if that made them happy, then kudos to them. But for me, this cream worked for me. And I'll say, like, man, just to have the cream for free, that's a blessing right there. And I know a lot of people don't have access to that. But that's what this video is about, is just this, to talk about the Opzelura cream, like I mentioned, and it works. Just be consistent with the cream. Like if you wake up Monday at 8, go brush your teeth, go bathe, whatever you gotta do, and then put your cream on. Or if you want to wash your face, do all of that and then put your cream, let it dry, then put your lotion on, or your makeup and stuff like that. But like I said, I don't even put on makeup, and I'm not putting on sunscreen or anything like that right now. I just put my cream on and I go about my day, because I really don't go out like that. But yeah, that's the video for now. And if you have any questions, please comment. I'll make another video. It's just a quick video. I just wanted to jump on here and just get it done. It kind of gave me anxiety, but I got it done, right? So anyways, have a good night, guys. And God bless.